Okay, so today I'm going to be doing a general exam on Carly. So we're going to get started with just pulse, and I'm going to do a radial pulse, and what you're going to do is count for 15 seconds and multiply by 4 to get your minute. So I'm going to place my index finger and middle finger on her radial pulse and take her pulse. So her pulse is about 80, which is normal because your baseline is 60 to 100 for a adult at rest. And next we're going to move into respirations. And normally you wouldn't tell your patient that you're taking respiration because you get involuntary breath sounds. But what you do is you're just going to place your hand on their back and tell them just to breathe normally, and the same rules apply. You're going to count to 15 seconds and count her respirations and multiply by 4 to get you to a minute. So go ahead and just breathe normal. Okay, and her respirations were about at 19, and that's also within the normal range. Your range is about 12 to 20 in a resting adult. Now we're going to take her temperature. You just have an automatic temperature thermometer, and you're going to turn it on, and you're going to place it sublingual, and just wait for it to beep, which is around, I think, like a minute. And your normal temp should be about 98.5 or 4. She's 97.8, so she probably drank something cold before this. Okay, and next we're going to do blood pressure. So I'm going to take my blood pressure cuff and place it on her left arm. It doesn't matter which arm, you're going to get the same thing, same blood pressure from either arm. And you kind of want her arm rested on a surface. She has really small arms. Sometimes the cuffs are sized. Okay, and I'm going to find her brachial artery, which is going to be under the belly of her bicep. I'm going to use my stethoscope to find it, and then once I do, I'm going to inflate the blood pressure cuff by just squeezing this when the valve is closed. You want to make sure it's closed so no air escapes. And the gauge on the side is going to tell me, there we go, is going to tell me the systolic and diastolic blood pressure. So we're going to find her artery and then blood pressure. And normally the blood pressure is going to be 120 over 80 is your baseline. And she was about 115 over 80. So in that range of normal to good. And the last thing we're going to do for now is we're going to palpate her lymph nodes. And what we're looking for is any swelling or redness or sensitivity to touch. And by looking at her, there's no swelling. But when I manipulate, palpate, there's no tenderness, there's no obvious swelling, and that's the submandibular lymph nodes. And now I'm going to palpate the anterior aspect of the, oh my gosh, right here, these lymph nodes. Yeah, no swelling, no tenderness. Right, this is tender when I do this. Okay, and that's it for now. Today we're going to be taking a blood pressure, and first you're going to need your blood pressure cuff and your stethoscope. Your baseline for blood pressure is 120 over 80, and you're going to listen for a systolic and diastolic noises to help you determine your numbers for your blood pressure. First, you're going to place the blood pressure cuff on the patient's arm. And then you're going to look for the brachial artery, which should be under the belly of the bicep. Okay, and once you found that, you're going to place your stethoscope where you find the brachial artery pulse. Okay, and you're going to make sure the valve is closed by twisting the knob all the way to the right. And you're going to pump it up by squeezing and then to release the valve, you're going to turn to the left. And that was like 105 over 65 was her blood pressure. Okay, next we're going to be using our otoscope to inspect the inner ear and the eardrum. So first you want to make sure that you turn it on so you actually see the light coming from the end of the otoscope. Then you're going to come over to your patient's ear and you're going to check just the outer ear to make sure there's no deformities or any injury to the outer ear. And also you want to make sure there's no secretion or any fluids coming from the inner ear. And what you're going to do is you're going to make sure your light source is on and that you can see through it clearly. You're going to pull the patient's ear low and look in the ear, and you're looking for any inflammation or redness, and see any, and you're going to look at the eardrum, and you want to make sure you see gray in color, no redness, and you want to see the light reflected back at you off of the eardrum, which I do. And we're going to go to her other ear. And we're going to do the same thing. We're going to look for any redness or any secretion of any fluid, and there's none on the outer ear. Now we're going to pull the earlobe back again. Look on the inside. Light is reflected back. Eardrum is all intact, and it looks good. Next, we're going to check the throat as well. You can use the same tool because all you need is the light source. So I'm going to have the patient open her mouth and say, ah, ah. Good. And what you're looking for when you're examining the throat is any redness or splotchy white spots in the throat. And you want to make sure to not have any because that's indication of infection. And that is it for this medical examination.